Today we're going to look at doing a central line dressing change. You will start as usual in doing this process by examining, is it time to change it? And the label on the dressing will tell you whether it's time to change it, but you also change the dressing if it is loosened or there's soiling under the dressing. You will need to change the dressing. Otherwise, with the central line, the normal procedure is every 7 days. Okay? So we have here a central line. This would be a subclavian central line. There are various kinds of central line as described in your lab manual. This particular one has 3 ports, as you can see, three lines. And so in bringing your equipment, you want to bring as many new ports as there are lines, and as many flushes as there are lines to come. So you are going to see it's time to do this. You'll gather your equipment, you'll bring it in, you will identify your patient as usual and wash your hands as usual before you proceed. Now, in doing a central line dressing change, although there is a mask in the kit, I like to have a mask on before I ever start. The patient will also need a mask, or you'll have to have them turn their head away, but because you're a student and they're curious about what you're doing, they're going to keep turning their head back, so get a mask on. It's much better. You will need a third mask because you have your teacher with you, and they will need a mask as well. So where can you get these masks? If they're not obviously available in the supply room, you can also get them in the isolation room. In the ante room outside an isolation room, they normally have supplies like this. Okay? So before I start, one of the things I do is I'm going to come and I am going to use some tape so that these ports don't shift around while I'm cleaning. I simply tape the ports down. This is not a necessary step. It's one that I do, just a personal preference kind of step. Okay. Now, you will need regular gloves to remove the old dressing, and you will have a mask on. Now, I'm going to act as if I'm putting the mask on, but for the sake of clarity, so that you can clearly hear what I'm saying, I will take this mask back off. Then the patient also has a mask on. You've already put it on him before you start any further with the work on the thing. So I would put one on. I will take it off because I'm speaking to you, but I would wear this throughout the procedure. Okay. In removing the old dressing, I always start a corner before I put my gloves on, because once the gloves are on, it's hard to start. Just lift a corner and turn it under, and you have a starting place once your gloves are in place. You are going to want to assess the site, and as we're coming in, you're looking for things like infection. That would be redness, swelling, any drainage from the site, that kind of thing. You're looking for infiltration, and you're looking also at the sutures. If the site is sutured in, you'll be looking at the sutures. Are they pulling? Are they intact? What do they look like? Is it pulling on the skin? Now, I've got regular gloves on, and I am ready to take the old dressing off. I will have a mask on. You look at the point of insertion. The point of insertion is where this line actually dives through the skin into the central circulation, and you want to come with the dressing as you're taking it off from every direction toward that point of insertion without uncovering that point of insertion until you're ready to take it off. So we're going to turn it under as we go, and I will simply begin removing this old dressing and rolling it onto itself so that the sticky goes to the sticky and doesn't stick to my gloves. One of the things you will learn with dressings, rather than pulling the dressing away from the skin, put tension on the dressing and press the skin away from the dressing. You are far less likely to tear skin if you do that. And take whatever time this takes so that you don't tear the skin. If you try to just rip it off, you're going to tear people's skin, especially these fragile little old people with fragile skin. Okay, getting closer. Coming up to the point of insertion. Now, once I've got it to where it's just kind of a wad over the point of insertion, I can remove the old dressing. You always remove the old dressing in the direction of insertion. If you pull the other way, you may pull this part way out, and then it's going to have to be checked again for placement before it can be used. Put a finger on the plastic, remove in the direction of insertion. You will then simply put that dressing inside the glove, pull the glove up over it. Want to pause? Okay, we are now ready to open our kit. I'm going to put my sterile gloves on first. Obviously not, because the kit is not sterile. So I'm going to open my kit and lift the kit out. And I also have a bio patch. You notice there was a blue patch around the point of insertion. This is impregnated with chlorhexidine, and it has reduced the number of central line infections by having this around the point of insertion when you put the dressing over it. I'm going to open my sterile kit. And notice there is now a mask, but you've already got a mask on, and so does your patient. At this point, we don't need that mask. Okay, so I'm going to open my kit, and there are differing ways to do this, and your teacher may do this somewhat differently. I do not treat this entire thing as a sterile field. My sterile field is what's within the kit. If your teacher wants you to work with the entire field as a sterile field, that's certainly an option too, and your teacher will show you what you need to do this somewhat differently. Before I can put my sterile gloves on, my bio patch needs to go into the kit. And this can get a little tricky. Unfortunately, the bio patches don't come in the kits on any that I've ever seen. I can touch this, but I can't touch the bio patch itself. It needs to stay sterile. And I want it in the kit. Okay, now we're ready to put the gloves on. You want to get gloves that are your correct size. I will normally get 2 pairs, because if I mess it up somewhere along the line, I then have a second pair available without having to leave the site, because once I've got that site open, that patient is wide open to anything touching that site can contaminate it. So I am now ready to put my sterile gloves on. And of course, the paper will tear. Anything that can go wrong does. Have you ever noticed that? Okay. Which one do you put on first? Dominant or non-dominant? The answer is yes. It doesn't matter. They've done clinical studies, and it doesn't matter which one you put on first. So you're going to put a glove on first, whichever one you choose. I know there's another finger there. I'm quite sure there is another finger there. Yes, there is. Okay. All right. Doesn't drop below your waist or it's contaminated. Doesn't touch anything or it's contaminated. We're ready for the second glove. Personal preference again, because when I try to go under the cuff, it sometimes scoots onto the outer edge and then is contaminated. I turn this so it has room to scoot as I'm putting my fingers in. That's just a personal preference, and you may choose to do or not to do that. Fingers go under and into the cuff here, and I put the second glove on. Now I'm ready to go into the kit. Retain the pair of gloves that's in the kit. Don't count on those being your size. They'll say small, medium, large, but you need your specific size to really fit right. And you're going to simply put those to one side in case you need them. Okay, now you'll notice that in the kit, there is a sterile swab. That is used when they first put the IV, put the central line in. Under the dressing, they will put a gauze patch because there is sometimes some bleeding. And so a day later, you'll remove that dressing and take the gauze patch off and put a new dressing down. So you'll do a dressing change 24 hours after it goes in, thereafter for every 7 days or as needed. But this is used to loosen up any clots that may be there, so as you clean, they'll be removed. This normally isn't used for anything else, although some people use it holding it with their sterile glove to lift the lines to be able to clean the skin. Okay? I am not going to use it that way, so I'm going to simply put it to one side. All right, in here next, there is an alcohol swab. This is rarely used in the hospitals these days. So I am not going to use this either, unless you want me to. Okay. All right, the next thing we see in here is a little stick man, chlorhexidine. Chlorhexidine is both biostatic and biocidal, kills the bacteria and kind of slows up the rest of them. It looks like a little stick man. Stand him on his head. You're going to break his arms and make him cry. So you're going to squash the arms in toward the body. We're not going to actually do it today, but you're going to squash the arms into the body. The fluid that's in here rushes down to the sponge and it needs to be wet. So you've made him cry. Now we're going to clean the site. You start at the point of insertion and you're going to clean that area. With chlorhexidine, you clean in a hashtag movement. So you're going to clean an area entirely in one direction, and then at a 90-degree angle, you're going to clean in the other direction. So the immediate area here of the point of insertion is where we're going to start. I'm going to scrub back and forth at the point of insertion, and you're going to want to go out about 1 inch to 1.5 inches in every direction from there. And then I'm going to go in the other direction and over the point of insertion until this area is cleaned, okay? At that point, I can come up alongside the lines and I can do them in the hashtag also, but I don't want to bring anything from them down into the point of insertion. And then your last step is over the plastic and up the lines, and if it takes more than one movement because your lines are more separated, that's okay. Come up the lines as far as you can, and then your cleaning is done. After chlorhexidine, it needs to dry for approximately 2 minutes. Then your little stick man is discarded. Okay, now I've let that dry. The next thing is I need to put the biopatch on. This gets a little tricky. It's just a little ring with a hole in the middle. This hole is bigger than you'll normally see for these central lines. And it has a split on one side, you'll notice. It has a blue side and a white side. The blue side actually normally has writing on it. The blue side is up, the white side is the side with the chlorhexidine. And you want that toward the skin. So we are going to then bring this down without touching the skin. I'm going to put it around the point of insertion. I can touch the top of it, but not the skin. And I'm going to put it in place. Nothing holds it in place. There is no adhesive or anything, but the dressing will hold it in place once you put the dressing on. Okay? Now we're ready for the dressing. You peel the back of it off. If it falls on the floor, let it. You can pick it up afterwards. Okay? The only rule here is that approximately in the middle of the window is where your point of insertion is. So I'm going to set this down over the point of insertion. Smooth it down over the skin and peel the edge off, smoothing it down behind it. Okay, at this point, your sterile part of this procedure is over because the site is now safely protected again. So that if I touch skin or touch something else at this point, I am not going to contaminate the site. The site is now protected. There is on this dressing wrapper a label. You can now take your pen and you write on here your initials and the date that it was changed. That then goes toward the edge of the dressing, well away from the point of insertion, so that you can always keep an eye on that and make sure it stays uninfected. So you're going to simply put this down and you've got it. Okay, it is now labeled. Learn to toss stuff as you go. It's amazing how much trash we generate. Okay, so now this part is done. This dressing change part is done, but I'm not done with the procedure. Because every time you do a dressing change, when you're doing the every 7 days dressing change, you're going to also need to do something more. You're going to need to flush the lines and you're going to need to change these ports. So I'm going to take this tape back off at this point. Okay, at this point, the dressing change itself is done, but we're not finished. Now we're going to get the pieces we didn't need until now. Remember I said however many ports you had, you have new ports. However many lines you have flushes, and we're ready for those now. Okay? And with each of the ports, you're going to take a new port They've got this one in backwards, interesting. Okay, I can take this out, I can handle it any way I need to because again, as with so many things, it's got a cap on it to protect sterility. I want a syringe on that, and I want to have primed this little port, so I'm simply going to put a little bit of fluid until I get a drip, maybe. Okay, so I now know that there's fluid in here. I'm going to replace these, and how I'm going to do it, now this should be a clamped line. I'm going to take the line, I'm going to remove the old port, I'm going to take the cap off this port. I want nothing to touch that because it's sterile right now. This is now sterile, I just took the cap off. I'm going to put sterile to sterile and screw the new one in place. Once the new one is in place, I can unclamp this and I'm going to flush the line. With the central line, you are going to flush using a pumping motion. You want to create some turmoil in the line, so if there's any portion of the line that has the beginnings of clot forming or any kind of debris at all, you're going to flush it out with this flush. And so you're going to pump action about 1 to 2 milliliters at a time until the entire syringe is emptied. And you will always use at least a 10 milliliter syringe, generally a 10 milliliter syringe. You don't want to use anything smaller than that because it puts too much pressure on the line. So, until the entire thing is in. Now, these are really nice syringes because they have a swab cap on the end of them. And you can see the cap there. And the cap has in it a little tiny piece of gauze, I believe, that has alcohol in it. So if I take this off, flip it around, I can put that cap right on top of that so that there's less chance of contamination of the port. We will do the same thing with each of the 3 lines. Once you have done that flush and replaced the port and capped it, be sure that each of these lines is clamped, because you should never have any IV in which fluid is not running that is not clamped. Now, in addition, we just flushed with normal saline, but you need to be aware of what's in the lines and what you are to flush with, and that's going to depend partly on what kind of central line it is. And you can look in your lab manual, it describes the different ones, and there are some where you do flush with heparin and some where you can flush just with saline, and you need to be aware of which is which. Okay, you will have replaced all three, you have flushed all three lines, you have clamped all three to make sure they're done, and your central line dressing change is now complete.